Hello students, welcome back to Easy Nurse, where nursing education made easy. So today we are here to deliver you the notes regarding the family healthcare conceptions. Okay, so what in this session we are going to discuss regarding the family healthcare service as well as home visiting and the IPR, maintaining the IPR with the family, and how we can elaborate the community and the sociology in as a unit of the health settings. So let's start about the today's live session. So mainly first we are going to discuss regarding the family health services. So what do you mean by the family health services? So as a community health nurse, when we are going for the visiting from one family to another family in one community settings, and we are collecting the history and the data regarding any kind of the history of communicable as well as the non-communicable disease, as well as if there is any chance for outbreak of any kind of the diseases. So based on that data, when we are going for the survey, so that is called family health services. So let's see, the family healthcare service, it's very a vital component of the community health nursing and then public healthcare services. So mainly their aim to deliver the comprehensive healthcare for the families, which is mainly focusing on the physical, emotional as well as the social well-being. So it's nothing but it's a collaborative care of the system. So mainly we are focusing on the physical well-being, emotional well-being, social well-being of each and every family members in the community settings. So that is called family healthcare services. And the main key aspect of the family healthcare service is nothing but first is maternal and child health. So that is the most important component for the family health service, that is the maternal and child health. So mainly in this maternal and child health, we are going to focus only for the pregnant women, means who are planning for the conceiving, who are already conceived and who are going for the delivery, as well as who are under the postpartum period of time, and then the children, mainly the newborn child to the adolescent age of people. Okay, so let's see, first is antenatal care. So what do you mean by the antenatal care? It's nothing but it's a regular medical checkup, vaccination as well as a health education for the pregnant woman. So antenatal period is nothing but before up to the delivery period, right? So from the conceiving to up to the delivery period, so this time period is known as an antenatal period. So in this time period, what are the treatment should be given to the mother, what are the health education treatment should be given to the mother, as well as what are the diet or what are the nutrition and what are the vaccination should be given to the mother. So these all are included in the antenatal care. Next come to the postnatal care or the PNC. So postnatal care is nothing but mainly during the postpartum period, means after the delivery to up to the 6 weeks of the post delivery period. So this time is also known as a puerperium period. So mainly in this time the woman is needed the support of the family is more and more compared to the antenatal period of time. So during this period, the family will be support for the mothers as well as the newborns after childbirth, and it's also going to emphasize the breastfeeding and then recovery of the mother from that anesthesia as well as the surgical period. So now come to the immunization. So now this immunization or the vaccination program is not stopped up to the mother. So now it's also coming for the newborn baby also. So based on the age wise of the newborn baby, like up to the 3 months, 6 months, 9 months. So based on the age grouping, we have to provide the vaccination to the newborn baby to prevent some kind of the diseases like communicable as well as a non-communicable and any kind of the diseases. As example, like polio vaccination. So polio vaccination 0, 1, 2 and 3. So these 4 doses are available based on the immunization schedule, right? So 0 dose we have to provide at the birth time of the period. So if we are going to provide like 4 doses of the OPV or the oral polio vaccine to the newborn baby, so we can able to prevent the polio eradications diseases for this newborn babies. So now come to the nutrition. So mainly for the pregnant women, means who are already conceived, so for them nutrition is a very much important component to carry out the pregnancy and to provide a safe birth of a baby, because like for the woman, suppose as example the woman is 50 55 kg when she conceived. Okay, so up to the delivery of the period of time, she have to gain weight up to 12 kg. So it's come around 67 to 70 kg. So based on that, we have to provide the nutrition to the mother. Okay, so if we are not providing the adequate nutrition for the woman, like when she is conceiving or when she already conceived, so what will happen? The baby, or which is fetus, is carrying out inside of the uterus of the mother, so the baby can't get the proper nutrition from the mother, and the baby will be giving coming out from the uterine side to outer uterine wall. So as like some complication should be present inside of the baby. Okay, so prevent those kind of the diseases, we have to main focus on the nutrition, and for this nutrition, as a community health nurse, we have to provide the health educations to the family members. So these and all the maternal and child health care. So now come to the family planning. This is also one of the most important component in the family health care services to prevent to manage the populations of our India. So family planning, what is the family planning? What are the methods of family planning? Why it's important for each and every eligible couple of our community sector? So each and everything we have to provide. So for this family planning, mainly we have to show the contraceptive services, which is mainly assisting the couples in planning for the pregnancy. And we also have to provide the counseling for the eligible couple for the reproductive health and responsible parenthood, and availability of the both temporary and permanent contraceptive options. So what are the temporary contraceptive options? Like for the male, that is vasectomy, and for the female, that is tubectomy. So same as like a temporary contraceptive method like IUD or female condom, male condom or diaphragm, anything they can go use it, right? So these and all the family planning we have to provide to the family. So now come to the adolescent health services. So mainly for the adolescent girls as well as the boys, we have to focus on the puberty, menstrual hygiene, nutrition, and then sexual health. So puberty is nothing but when the girls is when the girl's body is ready to promote the menstrual cycle inside of the hormonal fluctuations as well as the mood swings, everything. So that period is called as a puberty. And menstrual hygiene is nothing but when the girls is getting the period, so that time some hygiene they have to maintain. How they have to maintain the hygiene? If they are not maintaining the hygiene during the menstrual period, so what will be happen? What are the infections the people will get or that particular girls will get? So these kind of the education we have to provide, and inside of this we can also go for the school health services. Okay, so school health services, and in the school health service we also have to provide the iron and iron tablet to the girls or the puberty people. Okay, so addressing the issues like anemia, mental health challenges, and then the substance abuse among the adolescent, because adolescent period they are more engaging in the substance abuse like alcohol or any kind of the drugs or cigarettes, everything. So these kind of things we have to prevent it. And how we will check this anemia? By the measuring of the hemoglobin level for the women as well as for the men. Okay, and mental health challenges, because some people they are having like facing some mental challenges like depression, anxiety for some study purpose or some the personal life purpose. So that and all we have to execute it. So now come to the elderly care. So elderly care is nothing but specially for the older adults. So what are the nutrition we have to provide for the older people? As example, the semi-soft diet to the soft diet to the liquid diet. So why it's important? Why this sequence is important for the elderly people or the older adults? That we have to explain it to the family members. And also we have to in managing the chronic diseases, as example hypertension, diabetes, or any kidney failure or any kind of diseases. Okay. Next is emotional and social support also we have to provide for the aging population. Next is the prevention and control of the diseases. So prevention, how you are going to provide? Like prevention like awareness. So we have to provide the awareness among the community people by engaging them in any kind of the campaign or any kind of the healthcare camps or programs. So what will happen? By seeing that and by seeing or by listening those kind of the points or symptoms of that particular particular diseases by seeing any role play or any kind of the posters. They will get to know what are the symptoms of that particular disease, and based on that, if we are trained them, the family members, so they can also can able to manage up to the first level of period, right? So that's why awareness is so much important for the family members to prevent any kind of the communicable and non-communicable diseases. And early detection and screening is also one of the most important point for specifically for some conditions, as example diabetes, hypertension, as well as the cancer. So for the cancer, what are the detections, early detection and screening procedure? That is caution, right? Caution is like a coughing, then some bleeding, as well as unusual bleeding, then like hungry, we should not be present for that particular patient. So these kind of the things we have to mention it. So that is the specification of the cancer. So if this caution is present inside of that particular member in the community sector, means there is a chance to get the cancer for that person. So that's why we have to send this person to the PHC or the CIC or any kind of the district hospital for the screening. So if we can able to screening the cancer in an early phase, so what will happen? The people will be recover from that cancer cells. And then promotion of the hygiene and then sanitations for the spreading of infectious diseases. Now come to the mental health service. So mental health service is nothing but they are mainly going for the counseling for stress, anxiety, as well as the depressions, and they are also for the initiative to reduce the stigma, and they are also going to raise the awareness about the mental health for each and every age group of the people. Next is the school health services. So in the school of health services, mainly the regular health assessment as well as the immunization for each and every school children, and in the high school period like tablet like supplementations, as well as the vaccinations or immunizations, and then sanitary pad supply. So these are all the main component for the school health service, and in the school health service we have to educate the school children for the hygiene, nutrition, and then basic first aid. So what is the first aid component? Like bandage as well as gauze piece, then what are the solution they have to use, like Savlon or any kind of the antiseptic solution, oxygen peroxide or hydrogen peroxide, anything. Okay, so these kind of the components we have to describe it, why it's important, when we have to give it, and why we have to give it. So if they can able to know about the first aid, so by the first aid at least we can able to prevent some kind of the diseases, as example the diabetic foot. Okay, because mainly it's you can see for this particular disease, diabetic foot, for the diabetes patient. So if we know the first aid, at least we can prevent up to the certain level of the diabetic foot as an example. So now come to the community based outreach. So community based outreach is nothing but like home visit we have to go for the community health workers, as example the ASHA. So ASHA is nothing but accredited social health activist. Okay, so they are mainly monitoring the families and then individuals with a higher health risk. Okay, and if they are finding some complications, so they have right to send this particular patients to the particular hospital, as example PIC or CIC or any kind of district hospital, and if it is belongs in under any kind of the urban category, so they can send directly to the district hospital. Okay, so connecting the families to healthcare facilities for the specialized services. Next, objectives of the family health services. So first is enhance the health and well-being of all the family members. So mainly we can't focus only for the children or only can't for the like women. So we have to focus for each and every family member's health will are present in that particular family. So next is lower maternal and then child morbidity and mortality rate. So can you tell me what are the main reason for nowadays for the maternal mortality? So first reason is anemia, right? First reason is anemia. Second one is the HPV infections, HIV infections, and as well as cervical cancer. So these are all the main statistical ratio nowadays for the maternal mortality rate, right? So same as like a child morbidity, like fetal distress, as well as the lung immaturity, and then jaundice. Okay, so now come to the address the specific health risk, which is tailored the care plans. Okay, next is empower the families who are leading the healthier lifestyle lifestyle through the education and then emotional as well as physical support. So these are all the main objectives for the family health services. Now come to the principles of family health services. So mainly this family health service, they are mainly based on the key principles which are designed to deliver the comprehensive, equitable and then effective care for all individually family members. And comprehensive, why? Because they are focusing on all the specific like aspect of view, physical, mental as well as the social well-being. Equitable means the delivery of the care should be equitable for each and every family members as well as the family who all are present or belongs in that particular community sector. So the level of care or the quality of care should not be depend for any kind of the like social factor or any kind of the financial factor or any kind of the dressing factor, okay? And this care should be effective for each and every person of that particular community sector. So now see the principles. First is the comprehensive care. So why it's comprehensive? As I said, because they are mainly focusing on all aspect of view. First is physical, mental and then social well-being for every family members, and they are also going to provide the holistic services throughout the lifestyle from the prenatal care to the geriatric care. Prenatal care means when the mother is going for planning to conceive, okay? So from there to the geriatric care means old age people of care. Next is the accessibility. So accessibility is nothing but they are mainly ensuring the services while are affordable and then accessible for all the family members and then regardless for the socio-economic status and location at the cultural background. So nowadays from the Indian government, they are implementing some policies as well as some insurance for each and every hospital sectors. For that the person or the community people, they can afford the healthcare cost, right? So each and every policy and insurance based on the current situation, we have to provide the knowledge to the community members. Next is minimize the barriers for the healthcare which is happening by adopting the decentralized and then community based approaches. Next is the continuity of the care. So delivery, it should be consistent and then ongoing care of the acute as well as the chronic health needs. Sometimes what is happening, especially in the PAC, like one group of the people should be present, like healthcare workers, right? Somehow one person is giving the resignation or some person is getting sick of the healthcare workers, so the care or the continuity of the care is coming to as a breaking procedure, okay? So that time what is happened, the care of that particular patient should be continued by the other healthcare workers. The care should not be break down over there. If any healthcare workers is going to breaking the care, means providing care, if this process is breaking, so another healthcare providers we have to arrange and the continuation should be present inside of the PAC, okay? Next, if this kind of the cases you can see mainly in the PAC or the CAC, because the healthcare workers, number of the healthcare workers is very less in the PAC and then CAC. If you come to the urban sector like district hospital or the any kind of big hospital or nursing home, the continuation of the care should be present. Next, the foster long-term relationship with the families, they are mainly monitoring and supporting their health over the time. Next is the equity. So address the needs of the vulnerable and then marginalized populations as a priority. So based on the priority, based on the health conditions of the community people, we have to provide the care, and the care should be distributed equally for each and every family members or the community members, and work to eliminate the inequalities in the healthcare access and then outcomes. So now come to the family-centered approach. So family-centered approach is nothing but here they are mainly mentioning the family as a unit, and they are mainly acknowledging the interconnections among its members. So as the family members, when they are going to support the patients, so obviously the patients will be recovered soon from that kind of the diseases, right? And involve the families in healthcare decisions as planning for their care. So as example, nowadays during the delivery period, based on the IMNC recommendations, what is happening, they are allowing the husband of that particular mother inside of the labor room to see the procedure. So what is happened, it will be creating the emotional bonding inside among this particular couple, and they will be taking responsibility about the parenthood, okay? So that is called family centered approach, means engaging the family members into the procedures of the treatment, okay? So now come to the prevention oriented. Prevention oriented is nothing but health educations as well as disease preventions, immunizations and early detections. So if we are following these 5 or 4 components during providing the care, so what is happened, we can able to prevent some kind of the certain diseases. So that is called prevention oriented. So next is encourage the healthy behaviors and then lifestyle changes, because as we know prevention is better than cure, right? Next one is the coordination and then integration. So what do you mean by the coordination and integrations? So partner with the other sectors such as education, social service and then community organizations to provide the holistic care, and they are also going to connect the families to appropriate the healthcare service as well as the facilities for the specialized support. Next one is the cultural sensitivity. So respect and then accommodate families' culture, social and religious belief. Mainly when we are going to provide some the nutrition or some kind of the food, especially for specialized food for that particular disease to any kind of the patients, so sometimes they are going to disagree with to have this kind of the food. Why? Based on their cultural beliefs. So as a nurse or as a healthcare workers, we can't deny it. We have to accept their beliefs, we have to accept their cultural and social values, and based on that we have to provide a diet plan to that particular patient. Next we have to tailor the health interventions to align with the local values and then context. Next one is the individualized care. So individualized care is nothing but we have to recognize the unique health needs, preference and then dynamics for each and every family. So some family wallet belongs in the upper socioeconomic status, so based on this status they are demanding some little bit high. Okay, so based on their demands we have to take the proper responsibility from the PIC, CIC by maintaining all the rules and responsibility, and based on that we have to provide the care. Based on the other family socio-economic status, so they are also demanding, so based on that we have to provide the care. You can see in the hospital like a private ward as well as the general ward, common ward and two sharing ward, right? So why? Private ward is highly expensive, and in this the private ward they are demanding all the care. It should be very specifically for that particular patients, and they are also going to hire some families like 1 or 2 nurses as a permanently for that particular family, how many days they will be stayed in the hospital. So this kind of the care, it should be very specific, right? So now come to the two sharing ward, that two families they are sharing one ward, means 2 bed. Okay, so in this kind of the ward that care also should be very specific, and if you were compared to this care with a general ward, so it will be very like generalized care, right, in the general ward. So it should not be that much specifically for that each and every patient. So based on the patient's demand we have to take a step. Next, develop the personalized care plans which are tailored to their specific circumstances. Next one is the empowerment. So empowerment is nothing but we have to educate the families to take the charge of their own health as well as the well-being, and we also have to provide the resources and the knowledge how much they need to make the informed healthcare decisions. Next one is the partnership with the community. So what is happened, we have to collaborate with the community health workers as well as the local organizations for expanding the outreach and as well as the build trust. So as a nurse, if we can't able to build a trust or the proper rapport to the family as well as the community, so whether they will believe you? No, right? So as a nurse, first and main step to provide the care, that is maintaining the trust, build a trust and maintaining the rapport as well as proper IPR. IPR is nothing but interpersonal relationship, means professional relationship. Next, we have to promote the active participations from the community for the planning and implementing for health services or the healthcare plan. Next one is the accountability and then quality. So what is this? We have to maintain the high standards of the care throughout the regular monitoring and then evaluation, as well as we have to be very accountable to the community and we have to use the feedback for enhancing the services. Okay, so now come to the home visiting. So what do you mean by the home visiting? When this the community healthcare workers or the community health nurse, they are visiting one by one home in that particular one community sector, but detecting for collecting some data and providing some comprehensive care or the holistic care approach to the family members. So that time it's called as a home visiting. So see, home visiting is nothing but it's a very planned, purposeful as well as the professional interactions which is conducted by the healthcare providers or the community health services or the workers in the home environment for the individuals or the families, as well as it's also primarily objectives to deliver the healthcare systems or services and provide the education, assess the living conditions and address the specific health needs in a familiar as well as a convenient environment or the settings. So that is the definitions of the home visiting. So see the purpose. What are the purpose? First is the health education. Teach the families about the nutrition, hygiene, immunization and then disease prevention. Next one is the monitoring and then follow up. So we have to keep a track for the high risk individual such as the pregnant woman, such as the hypertension patient as well as the newborn patient, dialysis patient as well as the elderly patient. So what is happened while home visiting? If we are finding any kind of the serious things, immediately we have to refer to that patient to the hospital. Next one is the assessment. Assessment is nothing but we have to evaluate the physical, emotional and social condition which is mainly affecting the health of the family members. Next one is the service delivery. So service delivery is nothing but mainly basic medical care, counseling and then the referral service for the healthcare settings. Next one is the empowerment. So encourage the self-care and educate the families to take the responsibility for their own health as well as the well-being. So next one is the objectives of the home visiting. So what are the objectives? First is the health education, as I said, for the educating the family regarding health, hygiene, nutrition, etc. Next is early detection and then intervention, means early detection and screening for any kind of the communicable, non-communicable or any kind of the specific disease, as example the cancer. Next one is the promotions of the maternal and child health by providing the vaccination, by providing antenatal care, prenatal care, postnatal care, as well as by providing the psychological and emotional support to the pregnant woman and the newborn baby care. Next one is the chronic disease management. So managing the chronic illness like diabetes, hypertension or any kind of the tuberculosis by providing proper medications as well as isolations for the tuberculosis cases, etc. Next one is the support for the vulnerable groups. Vulnerable groups is nothing but the people who all belongs under the poverty line in our community sector. So those people is known as the vulnerable groups, and these people they are belongs under the as example hilly area side. So in these places what is happening, like communication is also not good and the healthcare workers, number of the healthcare workers also very less in each and every hospital, and the technology of the healthcare settings nowadays developing, right? But those settings, those area, the technology is also very much underdeveloped. Okay, so those kind of the people, what we happen, we have to provide the proper care and support for those people, and we have to give the advice to shift into the urban site for taking care about their health and well-being. Next one is the improvement of the family health practices to guide the families for adopting the better health practice and then lifestyle. Next one is the steps of the home visiting. First is planning the visit. So we have to first define the purpose and objectives of the visit. Next one is we have to collect the all necessary informations for the family and then individual. After that we have to prepare the materials and resources which is needed for the health education or the care. Next one is conducting the visit. So we have to establish the rapport to build a trust for the community and then family members. Then we have to observe the living environment for any health hazard, means which family, in which environment the family is belonging, whether they're maintaining hygiene or not, how is their housing structure, everything we have to observe. Next we have to assess the health needs for the family and individual, and we have to provide the appropriate health education, counseling or the care. Next one is the documentation. So documentation is nothing but like record the observation, intervention and then outcomes, and also we have to maintain the confidentiality and then ensure the accuracy. Confidentiality is nothing but suppose one care you are going to provide to that particular patient, but the patient doesn't want to disclose this procedure or the diagnosis to the family members. So that time as a nurse or as a healthcare workers, you have to keep it securely and keep it confidential. You can't disclose it. Okay. Next one is the follow-up. So we have to plan the subsequent visit if it is necessary, and if we also have to ensure the continuity of the care or the referrals to appropriate services. Next one is principles principles of the effective home visiting. So what are the principles? First is respect for the privacy, means keep it confidential or accuracy we have to maintain. Then cultural sensitivity, we have to respect the patient's cultural value, social value, as well as the cultural beliefs. And holistic approach is nothing but we have to addressing the physical, mental, social well-being as well as the environmental factors which are mainly affecting the health. Next one is the participation. So participation is nothing but we have to encourage the family members of that community settings to participate in any kind of the health decisions as well as the health campaigns to gain the knowledge regarding that particular disease. Okay. Next one is the establishing the working relationship with the family. So working relationship is nothing but that is IPR or interpersonal relationship. So it's a strong and professional relationship between the healthcare providers and the family. It is a very essential for the success of the home visit. Okay. So this relationship, which is mainly built on the trust, built on the respect and the mutual understanding, and it's also going to ensure the effective communications and then collaboration is achieving the health goals. Okay. So next one is the steps. What are the steps? First is preparation before the visit. So when we are planning to visit for going for the home visiting, so before that we have to plan it. We have to set the objectives. We have to collect all the necessary informations. Then we have to go for the research and review. Then we have to clarify our purpose, whether what is our main purpose to going for the home visit, and we also have to select the site of the visit and as well as our expectations. Next one is a cultural awareness. So we have to familiarize yourself with the cultural, social and religious practices which might influence the introduction. Next one is the introduction and then rapport building. So first is the warm getting. So when as a community health nurse you are entering inside of one family, so how you will going to greeting them like hi, good morning, I am XYZ, I am coming for the home visiting from this kind of the PIC and this is my job role. Okay, so like this way you have to greetings it. So if you are not greeting yourself properly to the family members, they will not give you like proper support as well as they will not share their informations what is actually you need. Okay, so that's why warm greeting is one of the most important and first step for rapport building. Next one is the clarify the objectives. What is your objectives and what is the purpose, so that you have to explain to the family members why you came. So as a student health nurse, when you are going for the home visiting in the community posting, so what is your purpose? To like collecting the history, doing the research and submit your requirements, right? So for your requirements you are going, and that only you have to explain it to the community people. So if you were explaining as a PhD nurse during your student period, so that time they can give you one like complaint about you, right? So that's why you have to ignore those kind of things, and what is your actual purpose, that only you have to clarify it. Next one is the active listening. Whatever they are listening, whatever they are saying about their problems, about their health problems, what is they are facing or the environmental hygiene or regarding anything, you have to listen it properly. So you have to be act as an active listener, then only you will get all the information actually what you need. Next one is the non-judgmental attitude. So based on their information, based on their like way of telling or based on the environmental hygiene, you can't able to judge to any kind of the people in that community settings. Next one is the building trust and respect. So maintain the confidentiality. Whatever you will get this information, you have to keep it confidential until they want to disclose it. Okay. Next one is the empathy and understanding. Whenever they will be listening, they will be sharing some kind of the informations, you have to be very empathetic and you have to understand their situation by placing yourself into their positions. Next one is the respect for the autonomy. So you have to, as a nurse, you have to respect your cultural beliefs, social as well as their own decisions and treatment process. Next one is the encouraging the participations. So collaborative approach. So we have to engage the family in the discussions and the decision making regarding their health and acknowledge strengths. What is this? We have to highlight the positive health aspects and offer the constructive feedback on the areas needing environment and then tailored solutions We have to offer the solutions and then advise their practical and aligned with the family's resources as well as the cultural context. Next one is the effective communication. So first is use the clear language. So as a nurse or as a healthcare workers, when you are going for the home visiting, you have to keep it in mind, you can't use any kind of the medical abbreviation or medical terminology. You have to use basic and simple language which will be understandable for each and every person in the community settings. Next one is a non-verbal communication. Use the positive body language such as maintain the eye contact as a calm tone. Next one is the ask open-ended questions. So we have to encourage the family to express their concern about the opinions. Next one is the addressing challenges. So first is conflict resolution. Sometimes what is happening, mainly it's happening like based on the treatment procedure. So as a healthcare workers, you are providing suggestions regarding one type of the treatment procedure and they are not ready to agree with this and they are suggesting or they are like telling another kind of the treatment procedure. So that time conflict is happening. So as a nurse, you have to handle this conflict in a very calm way. You can't able to be too much aggressive. Okay. Next one is the overcoming resistance. So you have to be very patient and you have to provide the evidence-based information for addressing doubts as well as the misconception. Next one is ongoing support and follow-up. First is the availability. So you have to assure the family for your support and provide the contact informations if it is necessary. And next is the consistent follow-up. We have to schedule the follow-up visit for monitoring the progress and reinforce the health practices. Next one is the individual, family and community as a unit of service. So this is the most important topic. Sometimes for the 2 marks question they are asking like explain the individual as a unit of services. So individual as a unit of service is nothing but like personalized care which is provided based on their individual physical, emotional, mental and then social well-being, and assessment that also going to include in the person's medical history, lifestyle, environment as well as the genetic factors. And the nurse-patient relationship or the IPR is going to be centralized to provide the effective care. Next one is the example like administering the medications to a patient. So that time how you going to administer? Directly you can't administer this medication to the patient, right? So before administering you have to explain it what is that medication, what is the use of that particular medication, and through the which route you are going to administer and what is the effectiveness for this medications. Okay, so these kind of things we have to explain to the patient so they will give the trust on you and after that only you can administer the medication. Then you have to provide the counseling for addressing the stress and normal health issues. Next one is a family as a unit of service. So family, it serves as a support system for individual like mentally, physically as well as emotionally, and the family centered approach they are going to address the collective needs which is acknowledging the family dynamics, and the health education also often targets the families to ensure they can manage the health conditions very collectively. So see the examples, educating the family on managing the diabetes for a member. So suppose one patient is or the one member is diagnosed with the diabetes. So that time as a family members what should be their role? By managing the diet of that particular people, right? So they have to focus on that particular people. They should not eat any sugar, they should not eat any high amount of the carbohydrate, high amount of the glucose rich food, right? So these kind of things we have to take care. So as a family members only those person only they can able to take care about the diabetic person. Next we have to provide the care plans that involve the family members such as the post-operative care instruction, means after operation when they are going for the discharge what should be the role of a family members, that we have to explain it so they can able to give that proper care to the patient and the patient will be recover soon. Next one is the community as a unit of service. So community mainly they are focusing on the promoting, maintaining and then the health of each and every members of the community sectors, and it's also going to involve assessing community resource needs and risk for implementing the large scale health interventions, and nurses also work to address social determinants of health like education, sanitation and then economic condition. So see the example, conducting the vaccination drives for all the community members. So one day they are conducting the vaccination for the newborn children, right? So all the newborn children are present in that particular community settings. One day they have to cover all the newborn children. Next, organizing the health camps for the underdeserved populations for providing the proper knowledge regarding the disease conditions, for managing the disease condition, symptoms and etc. Okay, so I hope you all understood my session. Again, we'll meet in next session. Till that, keep learning and stay tuned with the Easy Nurse. Thank you so much.